Here to explore lessons learned from the pandemic, please welcome Syra Madad, infectious disease epidemiologist and senior director of system-wide special pathogens program at NYC Health Plus Hospitals. David Quammen, author of Breathless, the scientific race to defeat a deadly virus. And Elizabeth Wrigley Field, assistant professor of sociology at the University of Minnesota. Here to lead the conversation is Atlantic staff writer Ed Yong.
Hello, everyone. I hate to be the bearer of bad news, but I'm used to it by now. This will all happen again. What we've lived through over the last 3 years is not some generational oddity, but one chapter of this era of epidemics that we find ourselves living in. In 2018, I wrote a piece for a little-known magazine called The Atlantic about how unprepared America was for the next pandemic. And sadly, that diagnosis hasn't changed very much. The COVID pandemic isn't over, no matter how badly the president wants to pretend that it is. We have a monkeypox epidemic underway, and more diseases, new and re-emerging, are imminent. Fortunately, we do have 3 excellent guests here today to help us to make sense of these risks and the hard work that still lies ahead of us. And David Quammen is a journalist and author of 17 books, including Spillover and his new book, Breathless, the scientific race to defeat a deadly virus, which is out next month. Please pre-order that. Dr. Syra Madad is the Senior Director of the System-Wide Special Pathogens Program at NYC Health and Hospitals, and that she's an expert in infectious diseases, and she's been neck-deep in the responses to both COVID and monkeypox. And Professor Elizabeth Wrigley Field is a sociologist at the University of Minnesota, where she specializes in racial inequality, in mortality, and infectious disease. She's also been doing some amazing grassroots work, getting vaccines into the arms of marginalized communities as part of the Seward Vaccine Equity Project. So to talk about the risk of that epidemics continue to pose to us, I'd like to start with you, David. You've written extensively about spillovers, how they happen, what might be done to mitigate the risk of them happening. I want to ask how you're thinking about the emergence of new diseases in the light of the last few years and what now needs to be done.
Well, as you said, Ed, this is not the last. You wrote about it in 2018. When I published Spillover in 2012, I was channeling scientists who had told me, the big one is coming, there will be a pandemic, it will be caused by an RNA virus, for instance, an influenza or a coronavirus. So no surprise there. Surprised that we were so unprepared. We need to be much better prepared next time, because there will be, as you said, another, could very well be an influenza, a bird flu that adapts for human transmission. We need more science. We need more surveillance. We need more preparation for the containment of outbreaks. As the scientists have said, spillovers are common, but pandemics are rare. And we can keep them rare if we have enough surveillance, enough education of people that there will be another one, so that when the next spillover turns into an outbreak of 10 people, 20 people, 30 people in some remote place, it can be contained before it spreads into an epidemic that becomes a pandemic. We can be sure that we will be challenged that way.
Okay. And it seems that no matter how good we get at reducing those risks, they will always be with us, that we can expect spillovers to happen, and maybe we'll be unlucky enough for more of them to create the sort of worldwide spread that we've been seeing. When that happens, diseases then test the healthcare systems of the countries that they land in. And so you've seen this firsthand, unfortunately. I wondered if you could tell us about the state of the US healthcare system in the wake of these last 3 COVID years, and what now needs to happen to steel it for whatever happens next.
Yeah, so I'm sure everybody remembers the very catchy phrase, early on in the pandemic, and that holds true even today when we look at risk reduction, where a lot of these metrics are now falling under. It's, flatten the curve, and that was for hospitals, right? We didn't want to strain our hospital capacity. Now, my background is in emergency management, and so I'm going to distill it down to the 4 S's that we often talk about in emergency management: staffing, supplies, space, and system. And so when we talk just about staffing, that's the most important asset to any healthcare system. And as you all know, this nation is facing a healthcare worker crisis, not just because of COVID-19 burnout and fatigue, but because it's constant, and there's not a lot of resource and support, that goes on in that sense. And certainly many healthcare systems are much more resourced than others, but there certainly is a dire healthcare worker crisis in this country, and it's only going to get worse. So if we look at what have we learned, we need to have more healthcare workers. We need to have more primary care, focus on primary care. And what this is doing is it's going to take away access to healthcare when you need it the most. The second, when we talk about supplies, and I'm sure everybody remembers the outcry of we need more N95s, we need more ventilators, we need more supplies. And luckily, we're obviously in a much better position now, but we should never be in that position again. So we need to build much better and more domestic capacity when it comes to supplies. The next is space, and as you all know, space is something in healthcare systems you have just a small amount of. It usually is a little bit easier to ramp up, but when we talk about outbreaks and pandemics, these are not one-day events. These are protracted events. Oftentimes are mass casualty events, and these are protracted mass casualty events. And even now, we have over 400 or 500 Americans dying every single day. That is a mass casualty event that's happening in this nation every single day. So we need to make sure they're developing, and sustaining both staffing, supplies, and space. And the last is system, right? And I can throw in so many different aspects into systems. But the one thing that I'll mention is we cannot rely on a crisis system. We need to rely on a 24/7, 365 system that works all year round and not just during emergencies, because then we will fail. So systems includes making sure that we have good systems for data collection, interoperability with public health, so we know who's dying, where are they dying, why are they dying, how are they dying. Some of the most basic questions we often even can't answer even today. So we need to have better data systems, both healthcare that feed into public health. We need to make sure we're looking at health equity. That's huge, right? If we learned anything from this COVID-19 pandemic, that needs to be first, it needs to be in the middle, it needs to be in the last. So a lot that we have learned from a healthcare perspective.
And I'm really glad you talked about systems, because I also then think about the social infrastructure of the country as one of the larger systems that have been problematic. Pandemics aren't just a medical problem, they're very much a social one too. And so, Elizabeth, as a sociologist, I wondered if you could talk about how you see that aspect of the pandemic, like to what extent the social fabric of the country affected our response to COVID.
Yeah. I mean, the way you get through a crisis like a pandemic with everyone working toward the common good is you have to have a spirit that we're all in this together. And that has mostly not been the spirit of this pandemic in the way that we have responded. We left essential workers unprotected, without PPE, without improvements in air quality at their workplaces. We left healthcare workers at risk and burned out without embracing some basic social provisions for the long term, like universal paid sick leave. We've left people in long-term care extraordinarily vulnerable, as we saw in the early days of this pandemic. We still pay people who work in those facilities so little that they often work at more than one, going from one to the next. You couldn't create a better super spreader situation if you tried. And I think what covers all of this is that we allowed businesses to approach vaccinations as a way to wash their hands of their own responsibility and put all of it onto workers. You get a vaccine, you check people coming in to see if they have a vaccine. We don't have to do anything. And that creates a setting where people embrace a kind of every person for themselves response. What feels so tragic to me about that in this pandemic is that we've learned so much scientifically in these last few years that we've just squandered. The alternative context where we are better prepared for the next pandemic is so tangible, we're just not living in it.
Yeah, I agree. That it feels like something that isn't unachievable, but that still somehow is slightly beyond our grasp. And the three of you have talked about quite substantial challenges that I wanted to pick at a little bit. So, David, you talked about the importance of education, and I think the communication part of this pandemic has been paramount. And as a science writer, as someone who specializes in talking about these risks to people, how are you thinking about the communication challenges going forward? Like, how can we get better at talking about this problem?
Well, we have to get better. I mean, you face the same thing, Ed. You're a journalist. You've written a lot about this. People get COVID fatigue. People get issue fatigue. People get tired of hearing about the most important challenges that we face. People get tired of hearing about climate change. So the challenge is to make it fresh, to make people read what you're writing or listen to what you're saying, not because it's their duty, not because they think that you're going to tell them how to stay healthy and what they should do tomorrow, but in part because you find a fresh way to do it, because you tell a story, because you write about people and not just about viruses. Emerging viruses have the advantage that they're all about detective stories. There's a new virus that appears in Malaysia or in Bangladesh or in Wuhan, China. Never seen before, a novel virus, and it's infecting humans. What kind of virus is it? Where did it come from? What's the origin of the virus? People go out there, the disease detectives, these heroic people, the field ecologists and others who study these viruses, and it's this horrific adventure to solve the mystery of this new virus. So it's part of our duty and our opportunity, I think, too, to put that into our work, to give people the sense that science is not just a body of facts. Science is a process of incremental discovery and improvement of our understanding of the physical world, and it involves heroic people going out there, climbing through caves, trapping bats, sampling them, working in laboratories, working in biosafety level 4 laboratories with dangerous pathogens. It's heroic, adventuresome, exciting work by disease detectives, and that, I think, is the advantage that we have in this horrific situation.
Mm-hmm. And when I think about heroism in this space, as well as the virologists and the basic research scientists you've talked about, I also think about the people who've done work at the community level to try and protect the people around them. And in Syra, you talked about the need not only for better staff, much more staffing at the healthcare system level, but also for more of an investment in primary care. I think arguably the US healthcare system is very tailored towards caring for people once they're extremely sick, rather than preventing sickness in the community. And I know you've thought a lot about this. Can you say more about what that might look like and why it's important?
Yeah, absolutely. And actually, the World Health Organization Director General, Dr. Tedros, I think says it best, and he just actually tweeted about it. And he says, healthcare starts, in the community, at home, at workplace, not in the hospitals. Hospitals are not the front lines, right? They are the last lines. That's when things are going really bad, is when you need emergency services. So we really need to make sure we're emphasizing early preventative care, primary care, and everybody should have access to primary care. And that is something that we still need to work on. In this country, we do a really great job in emergency medicine, right? We can save a whole lot of people. I also responded to Ebola, right? And we look at our Ebola cases, we did a phenomenal job when we talk about, saving individuals in that sense. But when it comes to preventative medicine, we are doing a terrible job, and we really need to emphasize that more. And that is really one of our key takeaways, is that we need to have a healthier population, a healthier community, if we are to prepare for and tackle the next outbreak. And right now, as you mentioned, I'm responding to monkeypox, and there's so many lessons learned from COVID that have been applied to monkeypox, and others that we unfortunately did not. And one of the things is we need to certainly do a much better job with communicating with the public of why it's so important to stay healthy, where you can get access to healthcare services and the like.
Thank you. And Elizabeth, I wanted to ask you to continue riffing off this idea, because you have done a lot of community-focused work in vaccine outreach, and we've talked about how valuable and how hope-building that has been for you. Can you say more about those efforts?
Yeah, I mean, this is a fundamentally pessimistic panel, right? For good reason, right? We've lost cultural ground on vaccines. We're on track to have excess mortality this year. Looks very much like last year, which is devastating. And we also have had a series of grassroots community vaccination networks that mean we have a legacy now of networks inside some of the most medically underserved communities in the United States of people who've tried to protect one another. And what that means is that people who want to do that know who each other are. They've learned some practical lessons about how you do a successful vaccine campaign. But I think most fundamentally, they have learned that when it feels like the state is abandoning you, you can actually band together with other people to try to stick up for one another's safety. And I don't want to paint too rosy a picture of this because I actually think that this work is in a pretty difficult moment right now. Everyone I know who's been involved in community vaccine organization, including me, feels pretty exhausted and demoralized right now at actually exactly the wrong moment with the new bivalent boosters. But I guess I also feel like on some fundamental level, like who cares? Because how we feel at this moment is not what's going to determine how those networks get used in the long term. And I think if we do end up prepared for the next pandemic, it'll be partly because people did try to figure out how to protect each other this time in this really grassroots way.
Yeah, it feels like we can't afford the luxury of nihilism in this. The challenge is substantial. But
we're an optimistic, pessimistic panel.
That's right. Yes. No. Thank you for setting up the next question I was going to ask you. So, as someone who has wrote about this risk long before COVID was a thing that affected humans, you and I both know that it's difficult to have done that work but still see tragedy unfold for you. So, thinking about the current status, David, like how are you feeling hopeful? Like what is motivating you to continue trying to tell these kinds of stories?
I think what's motivating me is that there is no alternative. We know that there is another one coming. There are more of these coming. We can do better next time. We won't necessarily do better, but there is a chance. Just as that there is a chance that we can control climate change, there's a chance that we can control the loss of biological diversity. And those are the three big challenges that face us on this planet. Threat of pandemic disease, loss of biological diversity, and climate change. And it's easy to wake up in the morning and say, oh, there's no hope, oh my God. But what better way to put meaning in your life than to say, no, we can never give up. These things are too important. You fight to the very end. You make incremental progress. You mitigate the disasters as you go. You see heroism in people that are trying to do this. And you see small, important successes. And you and I, we amplify those. We trumpet those successes. We tell those stories. And that helps everybody go on.
I think it's useful and perhaps a bit daunting, but certainly useful to remember that the three problems that you talked about are just facets of the same mega problem. They're all deeply threaded together. Climate change worsens the risk of pandemics in the future in a way that the loss of biodiversity also contributes to. And so going off this theme of continuing to fight and retaining hope, sorry, you talked about the staffing problems that the US healthcare system is facing right now. What might be done to address the losses of talented healthcare workers that have happened over the last few years?
Yeah, it's not just so much about the loss, it's also the brain drain, right? So when you lose healthcare workers, healthcare professionals, and the like, you're losing all that experience and many of those best practices and the like with that. And so even if you have a fresh workforce, you're really starting from ground zero. So A, obviously we need to do much more with increasing the workforce, and then B, we need to make sure that we have better systems in place to provide on-the-ground training and education. So when we have these types of pandemics, healthcare workers had no training when it came to COVID-19, when we had to say, use the same N95, not just once, but 5 times over in that sense, right? We need to have more robust training around outbreaks. But the one thing that I do want to mention is that, and this is something that was just echoed, is that pandemics are preventable, right? And we often conflate preparedness and prevention. And preparedness is knowing an event's going to happen and you're going to build a preparedness plan. Prevention is getting to the root cause. And we really need to focus very much on prevention just as much. This should not have happened. These are never events. And so absolutely pandemics are preventable in that sense, but we really need to have that political support.
I totally agree. And Elizabeth, just to finish off then, the COVID exposed and widened so many of the inequalities that have been deeply rooted in the US and are the things that you studied even before COVID happened. And those, feel much like what we talked about to be very, very difficult, gargantuan problems that also we cannot look away from. So how are you thinking about the need to handle that going forward in spite of the sheer scope of the challenge?
There's no shortcut around these problems. As devastating as the last few years have been, white mortality during the COVID pandemic has been less than African American mortality is every single year in the United States. So that's the challenge if you think about preventing death. I think a lot about ACT UP as a model to learn from. And one of the things it did is it combines this kind of direct service provision, the way that the community vaccination networks this time around have, but they combined it with a direct challenge to power, state power, powerful institutions like the Catholic Church and the media. And that's a piece that I think has been missing this time. And to me, that sort of says, well, if we want to do better the next time, that's something to think about.
Thank you. I completely agree. Thanks to all three of you for your brilliant insights today. Thank you for listening.